My name is Emma. I'm a fourth year neurobiology major.
Hi, my name is Arjun, and I'm a fourth year exercise sciences major. And our UROP project together is the GFP mediated visualization of therapeutic success in Pompe mice.
Genetic diseases often have little or no treatment available. In the Kimonis lab, we study rare genetic diseases like Fabry and Pompe. We were inspired to explore and improve on potential therapeutics that have already been developed for this disease in hopes that we can have a more long-term comprehensive treatment.
Yeah, so some impact that we think our project could have or might lead to in the future is that even though we understand rare genetic diseases only affect a small subset of our population, we believe that one, it should not be taken any less seriously, but also two, we hope that these delivery methods and these different avenues of delivering therapeutics is able to have a larger scale application to different diseases.
Through the Kimonis Lab, we've had the opportunity not only to work on the research aspect of projects, but also explore the clinical side. We get to see the work we do play a role in patients' lives through Pompe clinics that we have with patients. This project is important to us because at the Kimonis Lab, we know the research we conduct, such as the work in this Europe project, brings us one step closer to helping a real patient affected by Pompe disease.
Not only has this project been inspiring and we hope it has some sort of impact in the future, we've also both been able to gain a lot of insight and a lot of learning from the project itself. I think a couple of things that have been extremely useful to me is learning that sometimes um, things don't go your way. So it's important to pivot and go off things that have worked out and not dwell too much on things that maybe haven't worked out the way that you wanted it to. Um, I think also in a lot of research projects, as we've discovered, it's very, very important to focus on the details and specifics because these things really matter, especially when you're trying to test the efficacy and impact of drugs, which can often have a multi-system impact. You want to be sure that, okay, it's targeting where I want it to target. So it's important to know even what way or how to properly assess for the effectiveness of the drug.
And one of the most valuable things this project has taught me is the hands-on experience in techniques and experiments, including sacrificing mice, protein quantification, and Western blotting.
Our hopes and future steps are to continue working on the project with the Kimonis Lab in order to find more therapeutic options, not just with Pompe, but hopefully with other genetic diseases like Fabry, as we mentioned before, and to hopes that the project will continue to explore and evaluate ways to not only improve, but build on some of the gold standard potential treatments that we have for Pompe um, in the future. Thank you so much.
How long is it?